Good morning, everyone. So, uh, I am Dr. Subroto Mandal. I'm an intervention cardiologist. I'm working at Ubuntu Heart Hospital, Bhopal. On the occasion of World Heart Day, I want to give some message to my friends, colleagues, and my well-wishers, and my all my citizens and societies, peoples of society regarding heart attack. As you know, that heart attack is one of the most number one killer in our society, especially in the Southeast Asian countries, especially Indian subcontinent, especially in India. If you compare with the Indian population and the Western population, Indian population get heart attack at least 10 to 15 years earlier. Secondly, the reason behind this is the mainly we are getting more obesity and more diabetics in that, and more hypertensive patients, more other smoking. These are the main few factors. So first of all, I will understand what is the main causes for the heart attack. So main important causes for the heart attacks are obesity, or we can say diabetes, or hypertension, stress, smoking, and then especially it's a sedentary lifestyle. Most of the people, they are work in our life that they are sitting job, and especially after this lockdown or so, many people start working in sitting position. So these are things is very not good for us. And then we can say lack of physical activity. These are the few important factors which, if you can control, then definitely there is a chances that you will avoid a heart attacks. But question is that how will you understand that what is the symptom? How will you understand that is the signs of heart attack or angina? Basically, understanding is that suppose I will give you some basic idea that whenever you will feel something, suppose you are wearing a belt on your waist, or the same belt if you can wear across your chest. So if you tightly hold your belt on your chest, what are the symptoms you will get? That is all are symptoms possible to heart attack, just like tightness, subluxed chest pain, difficult to the breathing, difficulty in this, and then difficulty in walking, and then giddiness and sweating, and sometimes you can fall down also, and sometimes syncopal attack. And these all the symptoms can be present during the heart attack symptoms. Now, what you have to do? You have to immediately take a simple tablet that is called aspirin or Aspirin, or sometimes it is available in the any kirana store or something over the counter. You just to go to the counter and get some aspirin or Aspirin tablet or something which is. After that, immediately don't walk, don't exert your body, and immediately go to nearby hospital, any of your family doctors or nearby hospital. Then they will take some ECG, and then you'll see this what are the problems and advanced treatment given. Another important things, but what are the things that you will do and that somebody can prevent or from heart attack? I will give you some very basic idea of how we can get rid of heart attacks. Simple idea is that some of the words I'll tell now, and you have to understand that what is that. All of the words starts from the S. There is a formula of S. First S is for sugar or sweet. Whatever sweet thing or sugary, starchy foods that you should avoid. Second, salt. Salt, if you have to take salt only for 3.5 to 4 grams per day in 24 hours. If you can reduce your minimize your salt intake, definitely that you will be reducing, and subsequently your heart attack will come to that. It will reduce your heart attack. Third thing is smoking. You have to stop smoking. No, not at all. Any form of tobacco is permitted. Fourth is the saturated fat or salt or fat intake. Just like if you're taking more fatty foods, and which is sometimes you can say 2 types of cholesterol, that will not go into detail, but you have to try to avoid any form of fatty foods if you're not exerting, doing the physical activity. Third one is that another one is called physical activity or sedentary lifestyle. You have to avoid sedentary lifestyle, and you have to walk more, or at least something you have to start with your physical activity. Then come to the 3 things you have to very importantly in your life. You have to inculcate these 3 things in your life very meticulously, just like a sport. Any sport in your life is very important, except video game, but don't play video game. And that sports, or if you're not playing a sport that at least you can do 3 kilometers of walking, or some physical activity, yoga, meditation, or some other activities can be done. A smile, always be happy, because happiness also gives a lot of hormones that also creates our body system. It works better way. That also prevent our heart attack. And most important, I'll tell you, that is sleep. Normally, we don't care about the sleep and we don't give very minimal weightage to the sleep. But I think the sleep is one of the most important factor that everyone should give importance, because sleep is the part that where our body got regenerate, got reset, and restores all the things. So if you want to leave this, you want to don't have to anything that you feel that you should not have heart attack. So definitely these some points I told you, all of it was sugar, salt, smoking, stress, saturated fat, and sedentary lifestyle. This has to be stopped. And three things should be added in your life: a smile, and sleep, and sport. These three things and these six things should be added and stopped. And with this, you can live a very good, healthy life. And this will definitely, you can live longer for more than 100 years. With this note, I want to again emphasize that the quote for this World Heart Day 2021 that the World Heart Federation has released for the theme for this year is that we have to harness the power of social health. Or that means that if you have, first of your all, you have to gather the information how to stop or how to prevent heart attacks, and that information you have to circulate amongst your loved one, society, public, students, everywhere. So this will not only improve your heart, heart healthy, and definitely the society will be healthier. This also ultimately give a healthy world, healthy life, and healthy society. With this, thank you very much. Thank you.